High estrogen on testosterone replacement therapy. Should you take an aromatase inhibitor? This is one of the most misunderstood topics in all of men's health, and often clinics and patients are being prescribed aromatase inhibitors when they don't need them at all, and the simple fix could be through lifestyle, supplementation, or even just better strategic use of the aromatase inhibitors. So today we're going to talk about what the effects of estrogen actually are in the male body, what the effects of having high and low estrogen are, and then how we can modulate estrogen through lifestyle, supplementation, dietary factors, and then also the strategic use of pharmacologic agents like aromatase inhibitors when they are necessary. So if you're confused about having high and low estrogen, if you're confused on whether you should or shouldn't take an aromatase inhibitor, we're going to dive into all of that today. It's often thought that estrogen is just a female hormone and that testosterone is just a male hormone, and this could not be further from the truth. Although we both produce testosterone and estrogen, we do it in slightly different quantities, but they both have very important physiologic effects in the body. In men, estrogen is primarily produced from the conversion of testosterone in the testicles that goes into the body, and then it's converted to estrogen to exert its physiologic effects there. It's done through a process called aromatization via an enzyme called aromatase. Aromatase is found all throughout the body, but in large quantities it's found within the adipose tissue or the fat cells, the liver, the brain, and the bone. And so what does estrogen actually do in the male body, and why do we need it, and why don't we want to crash it down to essentially zero? Estrogen is vital for the bone mineralization. This is well understood in females that when females go through menopause and their estrogen declines quite rapidly, that they go on estrogen replacement therapy, and if they don't, they may have risk of osteopenia or osteoporosis, which is weakening of the bones, and risk of fracture within the bones. This can occur in males as well, whether it be due to decreases in testosterone and then precipitously decreases in estrogen because of the decreases in testosterone able to be converted to the estrogen, or if males are on testosterone replacement therapy and they're taking an aromatase inhibitor or something to inhibit the conversion of testosterone to estrogen, and estrogen levels are at significantly too low of a level, that we can get bone weakening in men as well, which can be extremely problematic because of the risk of fracture there. Estrogen is very important in regulating what's called rank L and then the osteoclasts. Osteoclasts are a cell that regulates the bone resorption or the bone breakdown. So there's a fine balance within the bone milieu of osteoblasts and osteoclasts. Osteoblasts are cells that help to build bone up, and osteoclasts are cells that help to break bone down. And they're required to be within a fine balance to help with bone strength, but also bone flexibility in a way. And so if estrogen is at too low of a level in men, then we cannot have proper function of the osteoblasts and osteoclasts, and this can lead to significant weakening of the bones. Another important role of estrogen in the male body is the regulation or the protection of the cardiovascular system. It primarily does this through the modulation of the HDL to LDL ratio. A lot of people understand that even though it's significantly more nuanced, that HDL tends to be the good cholesterol and LDL tends to be the bad cholesterol. That's a whole nother topic, but for sake of this video, estrogen is important in modulating both the HDL and LDL functions, and it's also very important for regulating the nitric oxide production within the endothelial cells. So what that means is we have endothelial nitric oxide synthase, which is the enzyme that produces nitric oxide. A lot of people think of nitric oxide and think of vasodilation or the expansion of the vessels, and that's exactly what it does here. So estrogen helps to modulate that enzyme eNOS, which helps to produce the nitric oxide and allows for the arteries to dilate, which can help with maintaining arterial elasticity and helping with regulations in blood pressure as well. And with cardiovascular disease being constantly on the rise and being one of the most common causes of death, an important factor there is that when we are on testosterone replacement therapy or a patient has low testosterone, that we don't want to crash the estrogen because of the importance in maintaining the cardiovascular system health there. Another way in which estrogen helps beneficially affect men physiologically is through the regulation of insulin sensitivity. Testosterone does this as well, but simultaneously, estrogen is able to regulate what's called the GLUT4 receptor, which is primarily found within the skeletal muscle and allows for glucose uptake, essentially for the muscles to suck the blood sugar out of the blood and regulate the serum blood glucose. It does this again through the translocation or the expression of this receptor that comes from within the muscle cell to the cell membrane, and then that cell membrane then allows for the blood, when it's passing by, to suck the blood glucose out of the blood, and then for the muscles to utilize it either as stored glycogen or as energy there. It also helps to regulate insulin sensitivity through the regulation of inflammation through downregulating cytokines such as tumor necrosis factor alpha and interleukin 6. When there's excess inflammation, this can negatively impact insulin sensitivity. So overall, estrogen and testosterone, but within a proper balance, are very important for improving insulin sensitivity, regulating blood glucose levels, and to get a bigger picture there, if insulin sensitivity decreases significantly for a long period of time, this can lead to things like prediabetes and ultimately diabetes. Another interesting role of estrogen within the body is through improving sexual function. So a large side effect of having low testosterone levels is the decreased libido and then erectile dysfunction. And that's often the cure, is increasing the testosterone levels there. And testosterone kind of gets the crown or gets the shine for that. But we do see in patients that have normal or high testosterone levels but very low estrogen, they can still experience erectile dysfunction. So how and why does this occur? Testosterone is important for increasing sexual drive and to helping to achieve erection, but estrogen levels, when in proper ranges, are very important for maintaining erection. It's likely due to neurologic factors and regulating some dopaminergic and serotonergic pathways within the brain. But another important factor is to maintain erection, you have to maintain the vasodilation within the erectile tissue. And like we talked about within the cardiovascular system of estrogen being able to regulate the endothelial nitric oxide, it also does that in the penile tissue. So overall, if you have low estrogen and high testosterone, you're probably going to have erectile dysfunction. If you have low testosterone and high estrogen, you're probably going to have erectile dysfunction. And if you have the proper amount of testosterone and a proper healthy amount of estrogen, you're going to likely not have, without other confounding factors, any sexual dysfunction there. So overall, estrogen is also vital for improving erectile function. So another one of the effects of having optimal estrogen within the male body is having better neurologic function or better mood or better memory. And we notice that when patients, again, have normal testosterone levels and their estrogen is low, they can still experience flat affect, or where they're not really experiencing, they're kind of numb to the world emotionally. They can have depressive symptoms, they can have poor memory, they can have decreased focus, or even depressive symptoms. And the reason that this likely occurs is because of, kind of like we talked about previously, is estrogen's role in serotonin modulation within the hippocampus of the brain. So testosterone is vital for dopamine drive and dopaminergic signaling within the brain, which helps to give that energy, that reward pathway. But another part of the balance between the neurotransmitters that make us feel good and help with overall beneficial mood function is the serotonergic functioning as well when it's within balance. So serotonin is often the pleasure neurotransmitter or the feeling of happiness. And so estrogen has a relationship to the modulation of serotonin within the brain. And so if estrogen is not within sufficient quantities, that a patient may be experiencing that, like we talked about, the depressive symptoms, the flat affect, blunting of emotional responses, or even irritability. Another very, very, very important factor of having proper estrogen within the male body is joint health. And I would say this is one of the most common symptoms that I see of decreased estrogen levels, where patients are feeling achy joints, or they're even having injuries to the joints or tendons, or they're just feeling like they can't move like they once did. Often when we look at hormone levels through blood testing, this is where the estrogen has been crashed, or the estrogen has been brought too low due to pharmacologic or AI intervention. So estrogen is vital for the decrease in the inflammatory cytokines within the joints themselves, and so we don't get as much inflammation with proper estrogen levels within the joint, so less pain there. And estrogen is also extremely important for collagen synthesis, which helps to maintain the joint and ligament and tendon integrity. And so say someone's getting stronger because their testosterone was on the low end, and now we brought it up to the normal high end, and they're feeling much better. They're increasing their reps in the gym, but they're reflexively, because of a clinician who's unaware of the beneficial effects of estrogen, is taking an aromatase inhibitor and they're crashing the estrogen down. As muscle strength goes up in that situation because of the increased protein synthesis and mTOR, and we don't have the proper estrogen, the tendons and ligaments and joints can then become weaker, and then this can often lead to injury, and that is not what we want at all. So estrogen is very important for collagen synthesis, and I believe the research is still loose on it, but also with the joint lubrication, I believe that there should be, just anecdotally in what I see in patients, estrogen is also very likely important for the joint lubrication as well. Another new interesting area of research is the role of estrogen within the prostate. So it's long been thought that testosterone and dihydrotestosterone, or DHT, were the big players in driving BPH, or benign prostatic hyperplasia, or the growth of the prostate. Recently, it's been found, or likely is occurring, that the aromatization of estrogen within the prostate, specifically at the estrogen receptor alpha, is actually driving the remodeling of the prostate more than previously thought, and likely more than testosterone and DHT itself. So where patients often thought when they had an enlarged prostate that they couldn't increase their testosterone levels because of the risk of further growth of the prostate, it's actually currently believed, it's up in the air, but the research is seeming to indicate that it's actually estrogen or higher estrogen levels within the prostate that's driving the prostatic growth, rather than it being DHT or testosterone itself. So that's an important part there to note, that we want to make sure that estrogen isn't getting too high because of its potentially negative effects on the prostate itself. So what are the symptoms of having too high of estrogen? It's often things like water retention, gynecomastia, which is male breast development. So even though men don't have breasts, they still have slight or small breast tissue. And when estrogen levels rise too greatly, that breast tissue can begin to grow, and this can cause nipple tenderness. And so that's a major side effect of having too high of estrogen. So another one would be decreased libido, like we talked about, and then issues with irritability, mood, or depression. Those are the big signs of overly high levels of estrogen. So now, what are the signs of low estrogen levels? Low estrogen levels can lead to joint stiffness, joint ache, joint pain, potentially tendon rupture, tendon injury. It can also, just like high estrogen can have poor libido, low estrogen can have poor libido or sex drive there. Other signs of decreased estrogen can be poor alterations in the HDL to LDL ratio, and then issues with insulin sensitivity, and then cognition, so memory, focus, and mood. So why does estrogen rise when patients go on testosterone replacement therapy? Like we talked about before, estrogen is produced from the conversion of testosterone to estrogen via aromatization, or the enzyme aromatase. So when men go on testosterone replacement therapy, their testosterone rises quite quickly, and the body can react in this scenario to saying, okay, we have a lot of testosterone, we're not used to this much, we need to convert it to something, and it'll often convert it in too high of a quantity to estrogen, or the other area that it can divert it to is the dihydrotestosterone, which we can talk about in another video. But the way to get around this, or the way to regulate the conversion of testosterone to estrogen, is not giving a bolus dose. In older practices, or practices that aren't staying up to date or aren't teaching their patients the pharmacokinetics of testosterone itself, they're often told to inject once a week, or sometimes even less frequently than that. Once every 2 weeks is what I've seen as well. And when this happens, the patient has a massive spike in testosterone, and then it slowly dips down until their next injection, then it spikes up and it slowly dips down. When this occurs, the testosterone at that massive spike, the body wants to convert it away to help stay in a homeostatic environment, or a balanced environment. And then it'll convert a lot of that testosterone to estrogen itself. So not always when patients go on testosterone replacement therapy does their estrogen rise too greatly. And this often occurs because of the proper injection protocols of doing more frequent injections, maybe twice a week, maybe 3 times a week, 4 times a week, whatever it may be, to achieve that balanced testosterone to estrogen ratio. is how often the patient, in my opinion, should be injecting the testosterone. And this also allows patients to use significantly smaller needles instead of the massive harpoons, the 1.5 inch, 21 gauge needles that I see people inject with. Patients often prefer even to use a 29 or in some cases a 31 gauge needle to do more frequent micro injections, and this allows for a better ratio of testosterone to estrogen. So how do aromatase inhibitors work? The most common aromatase inhibitor that I use in practice and what most men's health practices use is anastrozole. It works by inhibiting or competitively inhibiting the enzyme aromatase. And so this decreases the amount of testosterone that's converted to estrogen. And aromatase inhibitors aren't inherently bad. They're often said to be needed in everyone or not needed in anybody, and that's bad medicine in my opinion, where each patient should be treated as an individual based on their symptoms and based on their lab work, to where we're getting the most that we can out of the benefits of a normal to high testosterone level with a normal to high estrogen level without any side effects. And in some patients, they may just be a high converter of the exogenous testosterone to estrogen. And in that scenario, we can strategically use an aromatase inhibitor to help estrogen levels stay within a healthy balance without the patient experiencing any of the side effects like gynecomastia, water retention, or negatively lipid modulating effects. And so aromatase inhibitors should not, in my opinion, be used reflexively where patients just go on testosterone replacement therapy and they're given an aromatase inhibitor right off the bat, because often in that scenario, we're not going to get the benefits of having higher levels of estrogen without having the side effects and the higher levels of testosterone because of all the benefits of estrogen that we previously talked about. So long story short, on the note of aromatase inhibitors, is that some patients could benefit from them and some patients don't need them. It really depends on the individual. So now let's talk about why some patients may convert testosterone at a higher ratio than others to estrogen. The most often reason that I see this is because of higher levels of adipose tissue, or the patient has a higher body mass, or they have more fat mass. Like we talked about, the enzyme aromatase is primarily found in adipose tissue, the brain, the liver, the bone, and then also, not previously mentioned, it's found in the muscle as well. So if a patient has significantly higher levels of fat mass, they're going to have more of that enzyme aromatase present within their body. And so it is likely, and we often see that, the testosterone that's produced either endogenously through the testicles or given in a testosterone replacement therapy scenario converts at a higher ratio to the estrogen because there's just more enzyme aromatase within the body. We also notice that in very lean patients that have less fat mass, that they may not be converting as much testosterone to estrogen. And so in those cases, maybe someone is needing help with weight loss and they've put on a large amount of fat mass because of their hormonal dysfunction. And when we correct the hormonal dysfunction or the testosterone, we may need an aromatase inhibitor initially while they're starting to lose weight to regulate the estrogen. But as they lose their weight, that aromatase inhibitor can then be tapered down or possibly even ceased because of the decrease in aromatase when the fat mass is broken down and metabolized. So besides reducing fat mass, what are some other ways that we can regulate the aromatization or the estrogen levels within the body? One of them is through making sure that we have enough zinc within the body. Zinc is a very important mineral and it plays a vital role in countless enzymatic processes. But what I've noticed is higher levels of zinc can help to inhibit the enzyme aromatase. And so in patients that are averse to taking an aromatase inhibitor, or where we maybe think that the patient may be deficient in zinc, often supplementing with zinc itself can work as a minor AI in that scenario and help to reduce estrogen levels, and then also in some patients, maybe not on testosterone, increase testosterone levels itself because it also plays a role in the production of testosterone endogenously. Other natural supplements that you can use to help with working as a minor aromatase inhibitor may be things like grapeseed extract, or even resveratrol. And then another way in which that we can help to reduce estrogen levels, which I actually think are good strategies to attempt to use prior to the implementation of an aromatase inhibitor, is utilizing things like calcium D-glucarate and diindole methane. Diindole methane helps with the conversion of the more estrogenic form of estrogen to less potent estrogen forms. And calcium D-glucarate works through helping to enhance the glucuronidation, or the processing of estrogen within the liver for excretion, and decreasing its ability to recycle within the body. Another way in which that we can decrease estrogen naturally or more through lifestyle factors is if a patient's consuming a lot of alcohol. Alcohol consumption tends to decrease the liver, again's ability to excrete the estrogens and process the estrogens, and it can also work to enhance aromatase activity, the opposite of what an aromatase inhibitor would do, and increase the rate at which testosterone is converted to estrogen. So those are some more lifestyle factors that can be utilized to decrease estrogen levels and beneficially affect testosterone levels. And the other one that we previously talked about would be the injection protocol. I think that one's one of the easiest to implement. And if patients are especially injecting only once a week and doing that bolus dose, if they just switch to 2 or 3 or even micro injections every single day, we can often see decreases in the conversion to the estrogen and more favorable effects on testosterone and even DHT as well. So overall, if a patient has high estrogen on testosterone replacement therapy, there are a ton of things that we can look at and do, and it should be individualized to the patient. Too many clinics are telling patients to just reflexively take an aromatase inhibitor, and they're crashing their estrogen, and this can lead to side effects when the patient was in the pursuit of great health. Testosterone replacement therapy is fantastic for patients that have clinically low testosterone and are experiencing symptoms and want to feel better, but it should be discussed with the patient the ways in which that estrogen levels can be modulated through lifestyle, through nutrition, through supplementation, and then when needed, the strategic use of an aromatase inhibitor. So we're getting all the beneficial effects of healthy hormone levels without getting the side effects. If you have any questions, or are there any questions that I didn't answer in this video about testosterone or estrogen or the use of aromatase inhibitors, leave them in the comments below, and please hit that subscribe button. We're trying to get that subscriber count up so we can make more videos like this, and thanks for watching.